Robert James Graves is an Irish surgeon, after whom Graves' disease takes its name. He was president of the Royal College of Physicians of Ireland, fellow of the Royal Society of London, and the co-founder of the Dublin Journal of Medicine Science, Medical Science. He is also the uncredited inventor of the second-hand on watches. His medical career During his medical career, Graves returned to Dublin in 1821, setting up his own medical practice and introducing new clinical methods that he had witnessed on his travels to the Meath Hospital and the Park Street School of Medicine, which helped him found. This included, among other things, besides teaching, of which William Hale White said, "This is real clinical teaching," and went on in his book, Great Doctors of the 19th Century, to say that Graves held the honor of introducing this system to Ireland. Graves insists that mere walking the hospital must go. The Edinburgh system, in which the teacher interrogates the patient in a loud voice, the clerk repeats the patient's answer in a similar voice, the crowd of students round the bed, most of whom cannot see the patient, hears all this and makes notes, is of no use. Students must examine patients for themselves under the guidance of their teachers. They must make suggestions as to diagnosis, morbid anatomy, and treatment to their teacher who will discuss the cases with them. In this technique, one of his students, William Stokes, born in 1804 and died in 1878, soon became his collaborator. Together they made the Dublin School of Medicine famous throughout the world. Graves was possessed with of the qualities that would ensure a great teacher. He was tall, somewhat swarthy, with a vivacious manner, and like other avant-garde professors of his time, he gave his lectures in English rather than in Latin or dog Latin, as well as is still the case in most cases in the 1830s. In his introductory lecture, he said, "From the very commencement, the student should set out to witness the progress and effects of sickness and ought to persevere in the daily observation of disease during the whole period of his studies." He was appointed professor to the Institute of Medicine in the Irish College of Physicians and wrote essays and gave lectures on physiological topics. His clinical lectures were published in 1843 and again in 1848, giving fame to his name throughout Europe. He was president of the Royal College of Physicians of Ireland in 1843 and 1844, and was elected a Fellow of the Royal Society of London in 1849. He received honorary memberships of the medical societies in Berlin, Vienna, Hamburg, Tübingen, Bruges, and Montreal. Among the innovations introduced in the lectures are the timing of the pulse by watch and the practicing of giving food and liquids to patients with fever instead of withholding nourishment. It was on a word round that Graves light-heartedly suggested to William Stokes, "Lest when I am gone you may be at a loss for an epitaph for me, let me give you one." He paid favors as well as the practical importance of bedside learning to ensure that a graduate was not a practitioner who has never practiced. He emphasized the importance of research, learn the duty as well as taste the pleasure of original work. He corresponded with old pupils all over the world and continued as an inspired teacher until his death in 1853. Graves was sometimes sarcastic in dealing with a colleague's attack on the use of the stethoscope. The instrument was advocated by himself and Stokes, having been invented in France in 1816. He wrote, "We suspect Dr. Clutterbuck's sense of hearing must be injured. For him the ear trumpet magnifies but distorts sound, rendering it less distinct than before." Dr. Clutterbuck was Henry Clutterbuck, born in 1770 and died in 1856. In recognition of his achievements in education, Graves was named Research Professor of the Institute of Medicine in Trinity College. With William Stokes, he edited the Dublin Journal of Medical and Chemical Science from 1832 to 1842, a journal he had founded with Sir Robert Kane. Born in 1809 and died in 1890, his lasting fame rests chiefly on his clinical lectures, which were a model for the day and recommended by none other than Armand Trousseau, born in 1801 and died in 1867, who suggested the term Graves' disease. Now let's talk about the death of Robert James Graves. Graves kept a townhouse on Marion Square but died of liver disease at his country residence 20 March 1853 at age only 56. The year before he died, his wife persuaded him to buy Cloghan Castle, County Offaly, which was near to his cousins, the Droughts at Banagher. It was eventually sold by his grandson in 1908. He was buried in Mount Jerome Cemetery, Dublin. His library, worth £30,000, equivalent to 383 and 406, 649 in 2023, was left to Trinity College, Dublin. Following his death, a Dublin watchmaking company began selling watches with second hands, a concept Graves had come up with for personal use but did not patent. A collection of various of his papers, including a biography, was published by his friend and contemporary William Stokes as a Studies in Physiology and Medicine, London, 1863. So that's all simply about Robert James Graves, who is thought to be the discoverer of Graves' disease. In another video, and he is an Anglo-Irish. He is an alma mater of Trinity College, Dublin. He was born in Dublin and died in County of Offaly. And there is a very serious disease. It's called Graves' disease. This disease has been named after this scientist and teacher and doctor Robert James Graves. This disease is Graves' disease, are also known as toxic diffuse goiter or Basedow disease, and it's an autoimmune disease that affects the thyroid gland. It is because of it becomes hyperthyroidism or enlarged thyroid. There may be irritability, muscle weakness, sleeping problems, a fast heartbeat, poor tolerance of heat, diarrhea, or unintentional weight loss. So eye bulging, Graves' ophthalmology. These are the discoveries of Robert James Graves. I hope simply you have enjoyed listening to this video, and in another video we will talk about some doctors who have committed suicide only because of their excessive uh, excessive work and research. So thank you very much who have been watching this live session. I don't like to elongate my video because short video is very good to hear. And finally, I would like to tell you that um, don't only watch YouTube or Facebook. Just maintain your health. Have a sleep from 7 to 9 hours and have nutritious food. Have balanced diet and have exercise like walking for 30 minutes every day. And I think this will help you go a further way. And if you suffer from any problem, please visit a doctor. Thank you. Bye bye.